Now we'll look at secondary hypertension. So this will serve as a formal introduction to the concept of secondary hypertension. So under the secondary hypertension, we also look at the various things that could cause secondary hypertension. So what we have here is secondary hypertension. There is a rise in blood pressure. This rise in blood pressure is caused by something that you can identify. Okay, so primary hypertension normally somebody has a rise in blood pressure, but the cause is not clear. You can't really pinpoint one thing and say it is causing it. So, but unfortunately, most hypertensions we see they are primarily you can't really pinpoint what is causing them. Okay, so what are the common things that could cause hypertension? Now, whenever you are talking to a hypertensive patient, you are always working towards them to see if you can pinpoint if they cause it. So, kidney related issues like chronic kidney disease, diabetic nephropathy, glomerular disease, polycystic kidney disease, renovascular hypertension, where there is kind of like a narrowing in the renal artery, or there's a total blockage in the renal artery. Also, for hormonal and endocrine disorders like Cushing syndrome, where there's excess cortisols, um, aldosteronism, there's too much aldosterone, pheochromocytoma, there's a tumor in the adrenal gland. So it's making it that the adrenal hormone and noradrenaline they are produced too much. So your sympathetic nervous system is being activated too much. Also thyroid disease, then also when the parathyroid hormone is too much in the body. Then you can also have cardiovascular issues like coarctation of the aorta. Okay, see that. Kidney disease, medications, adrenal issues, pregnancy issue, genetic factors. So other medical conditions include obstructive sleep apnea, obesity. If your weight is so big, so there's a lot of what increased blood pressure. You know, your blood volume is increased. Also, pregnancy they call that the gestational hypertension or preeclampsia. Then sometimes some drugs that you are taking, their side effects could likely cause you, you know, hypertension. And these are the oral contraceptives like estrogen and progesterone, NSAIDs and corticosteroids, antidepressants, decongestants, and also herbal supplements like the licorice, the ginseng, the ephedra, then also illicit drugs like cocaine and also what amphetamines. So when should you actually suspect secondary hypertension in a patient? If this patient is young and is having hypertension, okay, I'm sorry, but hypertension is known to be a disease of the old people, okay, and if this patient don't have a history of having hypertension before, but it's just coming all of a sudden, and if this patient is known to have hypertension and you guys have been treating, you have been treating, it has not been solved. So that's to tell you the guy that you guys have not tackled the underlying cause. So you see that in their family members, there's no history of hypertension, okay, and a rise in blood pressure is just all of a sudden. Do you understand? So those complications, if left untreated, it could lead to damage in the arteries, aneurysms, okay, because the blood vessel wall is getting weak and weak and weak. You know, also heart failure from increased workload on the heart, kidney damage from narrowed vessels, and also this could actually damage the eyes. So the person is not seeing very well. That's retinopathy and cognitive decline. They're not able to remember very well. They're not able to see very well. They're not able to learn effectively.